many times when they do a biopsy, they come back with some diagnosis, things like Hodgkin's disease, non-Hodgkin's disease, lymphoma. What do these terms mean?
These are different types of lymphomas. Lymphomas are tumors of the lymph system, which are certain white blood cells that are located in the lymph nodes or the glands.
How common are they?
Lymphomas are the third most common malignant group after leukemias and brain tumors. Now these, also if they give you these diagnoses, sometimes it actually may be reflective of an underlying leukemia. It's just that you diagnosed from the lymph node before getting to the bone marrow.
That's a kind of cancer. Sometimes the stage is not as critical as how the effectiveness of the medicine you're using. Is that true?
The stage is not as critical typically in lymphoma. The biology of the disease is much more important, so that
it's not like an antibiotic that is sensitized or not sensitive.
Right. Some will respond very nicely to chemotherapy, and you can have it all over the place and have a stage 4, which means it can be in the bone marrow as well, versus other types of lymphomas that are very aggressive and are less responsive, even if you have localized disease, can be much more difficult to treat.
In general, if you do get a lymphoma and it does work with the medicine, you expect to get a cure. Is that correct?
Yes. I mean, the cure rates overall on lymphomas are very good. You're looking in 80 to 90% ranges. And some lymphomas that we used to consider very difficult to treat now are curable greater than 90% of the time.
If for some reason the chemotherapy doesn't work, do you ever consider things like bone marrow transplants?
Yes, in patients who have refractory lymphomas, going to a bone marrow transplant can be effective. When we look at the bone marrow transplant, what we're doing it for is something called immunotherapy, or using the immune system to treat this, meaning that you take the immune system from a different person, transplant it into the patient, and the goal is for that person's immune system to recognize the lymphoma cells as foreign and to continue to attack it. And what can happen is as the immune system recognizes the patient as patient, it becomes tolerant to the patient but not to the lymphoma, and can help cure the lymphoma.